I'm going to talk about a very specific thing that in hair restoration, which is the hair curl. Why talk about this? What is it? So I'll start with a story. This past year, Amina was teaching some very seasoned and veteran assistants at our course in St. Louis, where I've been running a course about 12 years. And the assistants who've been doing it for 20 years somehow had no idea what the hair curl was. And Amina taught them about the hair curl, and all of a sudden they're like, wow, this is the best weekend we've had because we've learned something critical that we should have known 20 years ago. So what the hair curl is that the hair, when it exits the scalp, has a slight curvature to it, and it typically points toward the scalp. So if you, when the assistant, and this is why it's so important to have a great assistant, not just a great surgeon, is placing the hair graft into the site that is made by the doctor, that the hair curl is not just placed willy-nilly in there, but is actually placed facing forward and downward, because the hairs won't grow naturally and they won't be as combable if they're placed incorrectly. So the hair curl is really something that's more focused on what the assistant does, not what the surgeon does. So the assistant must place the hair curl correctly. This becomes absolutely critical when you're talking about insertion of hair grafts for the eyebrow, because the eyebrow, when I make an eyebrow transplant, my recipient sites, that is the sites into which the grafts are placed, are designed very super incredibly flat. If they're too high, they just look completely fake and don't look right. And if you put the hair curl backwards, not only do the eyebrows look unnatural, but they look unkempt, and they grow sticking straight out of the skin. So the hair curl is so important. Now, can you always see the hair curl? So this is interesting. When you do an FUT procedure, a strip procedure, the hair curl is very obvious. When you do an FUE procedure, you actually don't see the hair curl, because you need to trim the hair short enough that you can actually harvest it without hurting the hairs or having a difficulty of harvesting it. And of course, you can do a long hair FUE, which is a little bit more cumbersome to do, and I've done that as well, in which you can see the hair curl. But then the natural question is, if you're doing an FUE and you can't see the hair curl, is that causing the grafts to be placed incorrectly? And the answer is no. And the reason why is the epidermal cap. The epidermal cap is that the hairs it grow out at an angle, but the epidermis, or the outer lining of the scalp, also is beveled. So if you follow the natural angle of the bevel of the skin, it will tell you the natural direction of the hair curl. This is probably pretty hard to explain without drawing out an illustration, but suffice it to say that even though the hairs are trimmed very short, and even an FUE graft, you are still able to tell the hair curl by the direction of the way the skin is. So an experienced hair assistant will be able to respect that and deliver on that. So this very short blog talking about one very specific nuanced point of hair restoration is actually very critical, and it has everything to do with the quality of what the assistant is doing. And this is why, even though you go to the best surgeon in the world, if your assistant team is not the best, your outcomes can be quite compromised.